The people that are taking these drugs most are big men children. I'm telling you.
Drug abuse has moved from isolated cases to what many describe as a growing public health and security concern. Community outreach workers say they are seeing more teenagers experimenting with substances from codeine, heavy cough syrup, and tramadol to cannabis, and in some hotspots, other drugs. Parents tell of children sudden changes in behavior, poor school attendance, and in some cases, involvement in petty crimes to fund habits. Residents in Menace urge the government at all levels and law enforcement agencies to put more effort in curbing the menace of drug abuse among youth in the state.
What is happening in the society now is that most of our youth are now being addicted to these drugs. More especially this what they call tramadol, name them. You see them misbehaving, but it's very painful that the people that are supposed to be in charge to encourage our youth not to take all these drugs are the one taking it most. For example, like our first agents, you see them taking this thing, even the what they seize, how they do it.
I believe they've enacted laws that will help restrict those things. Most of these things is the implementation. If they are able to execute it the way they ought to do, where they need to, there is penalty, there is punishment, they enforce those things to a very large extent. If they don't do favorism and all that, the drug issue will be reduced to the barest minimum.
There should be a foundational education on the use and abuse of drugs, particularly the illicit drugs. Once that is infused into the curriculum from the elementary education system, your primary school, it will go a long way. And then students and non-students alike should be well educated, as it were those days, by parents and members of the society, because in the older days, you will recall, people lived in a communal life setting. Every child belongs to everybody.
Drug abuse is not a single actor problem and cannot be solved by arrest alone. Community members, health professionals, and law enforcement all agree that early prevention, accessible treatment, and meaningful youth opportunities are needed now. Families want support, not only sanctions, and many young people in recovery. With coordinated action, stakeholders believe the trend can be reversed and lives rebuilt.
Let government put more effort, and let the force agents let them put more effort, and make sure they stop this menace.
In Edo State, is on the increase, and it's not good for our youth because they are the future generation. And one thing I suggest the government should do to control to the lowest limit on how this drug is being circulated is through education. Education. You catch them young. When they are occupied, even you don't give them space. During their holidays, nothing to do. Even these holiday lectures now, summer lectures now, it's failing already. People are getting tired of reading. Take them to skills. Teach them how to do one or two things. Teach them there is future. When you do this thing, you can earn a living.
They said laws should be enacted, and the verb also ensure that law enforcement agencies should display good example for the youth, sensitizing the youth on the effect of drug abuse. Families here in Benin City are asking for help before more young lives are lost to addiction. The clock is ticking, and residents say the time for a joined-up response is now. Osarogi Agwebo reporting for BTV News.